New tonight, as RSV season is upon us, the CDC says the new vaccine for babies is low in stock across the country. They have recommended new guidelines to tighten up on what age group should get the shot to make it through the RSV season. KLTV's Avery Niles has more on those guidelines.
Nirsevimab, an antibody boosting drug to prevent RSV in babies, is now in short supply. Bill Wallace, an ER physician at Tyler Complete Care, says this is a newer preventative.
There has been a medicine sort of like it, which was a monoclonal antibody that's been available for several years. The indications were very restrictive, and it had to be administered monthly for it to be effective. So this was kind of a game changer for RSV prevention, since it is a one-time shot.
When the preventative was first announced, it was given to newborns and babies up to 8 months old and older babies with chronic illnesses. Now that there is a shortage, the CDC recommended to limit it to the most vulnerable, which is babies up to 6 months old and older babies with chronic illnesses.
Unfortunately, this fall, there's not going to be nearly as many babies receiving this medicine as we might have hoped, but hopefully going forward it can really help.
The Texas Department of State Health Services sent us a statement reading in part, quote, the DSHS Texas Vaccines for Children program contacted its partners on October 23rd to reinforce the CDC recommendations and to encourage them to help families understand prevention strategies they can employ to protect babies from severe RSV illness. With these recommendations, physicians believe Texas will have enough of these preventatives to last through the season. Avery Niles, KLTV 7 News.
The CDC expects additional doses to be made available every 2 to 3 weeks, and that supplies will remain limited throughout the fall and winter season.